Hi, my name is Zachary Kovac, and I am a senior at Purdue. I will be graduating next week, and I am in your abnormal psychology course. And for my case study project, I chose to read Down Came the Rain, Brooke Shields' study on her story about how she struggled and dealt with postpartum depression, how she got through it, what her symptoms were, how she was treated, and how she got better. One thing I really wanted to point out that she came across really well was that this can happen to anyone. It doesn't matter what social class you are. Postpartum depression does not respect social boundaries. It doesn't matter if you're the poorest of poor, the richest of rich, if you have everything, if you have nothing. It doesn't matter. It can happen to anyone. And I think that came across really well in this. She talked in the beginning of the book how great her life was. She had a great career. She met the man of her dreams. Everything was going really well for her. And all she ever wanted to do was have a child. She loved children. She loved babies. Anytime she saw a baby, she wanted to pick it up and hug it and play with it. And she always wanted to be a mom. And um, she tried really hard with her husband, and they struggled for a while, but she was finally blessed to be pregnant. And she had a healthy baby girl. And the scary thing to her was once the baby was born, she was very unhappy, and she was not able to. She did not think she was able to become a good mother. I'd first like to start with the history of postpartum depression. It can actually be traced back to 4 BC. Hippocrates told a story of a woman who gave birth to twins, and by the 11th day had become an insomniac and very restless. And by the 17 days after birth of her children, she died. And this is the first recognized account of postpartum depression. Although it's very, very severe, and there's been very many disputes to it. But there have been studies on it as early as 1983 talking about the causes that lead to postpartum depression, and that's where I'd like to go into now. There are 3 main types of causes for postpartum depression, and the first I will discuss is physical change. There are decreased amounts of hormones. While a woman is pregnant, so many things happen physically. She's gained lots of weight, she's carrying a life inside of her. There's so much change going on with her, but one thing people don't recognize or fail to see is that she has a bunch of chemical reactions going on inside, and she has lost or decreased amounts of estrogen and progesterone, totally lower than you could ever have, and as well as on top of that, thyroid hormones have decreased as well. And all of this can lead to fatigue, sluggish behavior, and depression. On top of that, there's a decrease in blood volume, blood pressure, and your immune system changes. So there's a whole bunch of changes going on inside of you. You may not recognize, but it's slowly happening. And once you don't have it, you can totally become depressed. Mood swings, fatigue, it all becomes a part of it, and it leads down a slippery slope to depression. The next group of causes are emotional factors. Postpartum women often become overwhelmed and sleep deprived, and they start feeling anxiety and loss of control over their lives. Their life is not, every decision they make is not about them anymore. They have to take care of a baby, and they can't just do everything on a whim anymore. Every choice is first about the child. And this goes along with that. They struggle with their identity. They had a great career, but now that's a second burner to this new child that's into their life. And they just really struggle with that. And then they question if they can even care for the baby. And that's something Brooke Shields did. She didn't know if she could take care of this child, and it really scared her. And the final category of causes are lifestyle changes, financial changes. Babies are very expensive to take care of, hundreds of thousands of dollars to take care of. And if you don't have a lot of money, it can be very trying on you and your family. If you don't have support of your spouse or your family and friends, that can also be very trying mentally, and it just causes mental exhaustion, which can also lead to depression. You also have to make sure you take care of the child's siblings. One thing you need to do as a newborn mother is to take care of your baby, give it all the attention it deserves and needs and requires to live. But on top of that, you have to give all that other attention back to its siblings, so they don't get deprived, and make sure that everyone gets their amount of support and attention that they need. And also, if the child and the mother have difficulty breastfeeding, this can also be a mental punch thrown to the mom. She might not take it very well, and it can lead to mental depression. A couple facts are postpartum depression usually occurs within the first 4 weeks. It can happen. It can last for a couple weeks. It can last for a couple months, and it can last up to a year usually sometimes. And 1 out of 500 mothers in America have postpartum depression. The symptoms of postpartum depression, are mood swings, mood liability, preoccupation with the infant well-being. You making sure everything's okay with you. You become worried all the time. You never know if everything's going to be okay. Sometimes you have frank delusions and go the totally opposite direction and start having delusions that you should hurt the child or cause harm to it, and that's just something that's just absolutely terrible, and it's very scary to think about. And these are some of the things that Brooke Shields was going through. She talked about how she felt exhaustion all the time, and a panic came over her system, and she had started having sick sensations in her stomach and her chest, and she just knew something wasn't right, and she became very unhappy. And she didn't want to get near the baby not because she didn't want to touch it or because she didn't love it, but because she didn't care. Like she didn't want to be a mom at that point, and it just devastated her, and she just became absolutely depressed. There are two forms of treatment for postpartum depression. The first one is counseling, and counseling allows postpartum mothers to rationalize their thoughts, solve problems, and make realistic goals towards getting better. It's just something. Talking about it can definitely help the situation. They often talk to psychiatrists, psychologists, and other mental health professionals. And on top of this, I talked earlier about how you need support from your family and friends, and marital counseling and family counseling can also be effective treatments. If you don't have that support, or it can also, if you have the support, it'll help your family and friends and your spouse to better know how to take care of the situation, how to handle the situation, how to take care of you and the baby. The second group is medication. This has two subgroups, the first of which is antidepressants. As I'll talk about in a moment, Brooke Shields actually was on an antidepressant, but one thing you need to make sure if you take antidepressants, and doctors take care of this, is that if you are breastfeeding, you have to make sure the medicine can't get through to the baby and harm the baby. But antidepressants are effective in treating postpartum depression. Another treatment by medication is hormone therapy. As I mentioned earlier, estrogen and thyroid hormones and progesterone have decreased levels in the body, and hormone therapy replaces that and reintroduces estrogen into the system, which levels it out where it should be, and this helps also in the treatment of postpartum depression. One thing that mothers need to realize or recognize is even if they start feeling happier or a little bit better, they need to continue treatment. They can't quit early because a relapse can occur, and that is absolutely devastating. The treatments that Brooke Shields had, she definitely had support from her husband. Her husband was with her every step of the way, loving on her, doing anything he could. One thing that really helped was her child's godfather, who was actually one of Brooke Shields' best friends. This really helped the situation. He kind of pushed counseling and medication on her. And also her mom. Her mom gave her a lot of support, moral support, verbal support, just letting her know that she was fine. She was going to do it. Like I said earlier, she ended up taking medication. She took Paxil, which is an antidepressant. And she only took it if her doctor would promise she would not get addicted and not take it forever. She claimed that she never taken drugs, and she didn't ever want to be that drug pill popping person, and so she didn't want this to be something that was ongoing. She also got into counseling, and this all helped. All these treatments helped her. And one thing that was not really mentioned as a treatment, but just as a side story, was how she hired a baby nanny. And I feel like this was a big helpful situation for her. The baby nanny took many duties away from her. Just relieved her, gave her some time off, let her relax. And I think that was very helpful. But while doing that, she also integrated the baby with Brooke Shields with her baby, and this really helped the relationship between the two of them. One thing that also helped her was talking about it. She started talking about it in social settings. In her book, she mentioned how she believed that talking about it was this white elephant. You were not supposed to talk about it. But she also said talking about was like one of the greatest things she's ever done. And as a white elephant, you're not supposed to talk about these things, but slowly and surely in our society, it's becoming more socially acceptable to talk about. My favorite TV show is Scrubs, and there's actually an episode where one of the characters, Carla, has postpartum depression, and I actually have a couple of clips for you to see to show what how postpartum depression has been mentioned in media.